Hi, everybody. I'm Marguerite Ro. I'm the State Director for AARP Washington, and I'm very happy to be having a conversation with an amazing caregiver, not only personally, but in fact for the residents of Washington. And I'm here with Dr. L-T Chen, the Public Health Director at Tacoma-Pierce County Health Department. Anthony, it's a pleasure to be here, and if you don't mind, would you let people know a little bit about you and introduce yourself a little bit more?
Of course, Marguerite. So, I grew up overseas, right? So my parents came from Taiwan. My dad used to work for the World Health Organization. So I was actually born in Vietnam when my dad was working there. Then we lived in East Malaysia, then West Malaysia. And when my parents moved down to the South Pacific and the Solomon Islands, I came to prep school here in New Hampshire. After that, did my college at Michigan, which also happened to be where my father had done his MPH, his public health degree, back in the 50s. And then went to med school at Duke, did my residency at Cincinnati, and was working in the Chicago area for a few years, and then moved out into the Seattle area in 1993. And I've pretty much been here the whole time except for a few years when I took a hiatus, went to Harvard, did a fellowship in minority health policy, and then came back here, and I've been the Director of Health here at the Tacoma-Pierce County Health Department for the last 14 years.
So a lot of people know who physicians are and what they do, and when they hear doctor, right? Mm-hmm. So Dr. Chen, they think mostly of medical care. So can you just, for folks who might not know, just describe what it means to be a public health doctor?
Yeah, so actually, I am a family physician, and when I first came to Seattle was doing teaching and also working in the public health and community clinic settings, and that really was a lot of my passion, working with underserved communities, especially, with refugee and immigrant communities. But then when you become like a health director or a health officer, your patient really becomes the community, right? So my patients are the 900,000 residents of Pierce County. And actually, I'm not sure patience is the best word, but, my job is to coordinate my team to take care of the 900,000 residents of Pierce County, and our vision is for healthy people and healthy communities.
So I love that idea. I love the idea about caring for our communities and such. And I think over the last couple of decades, in fact, what we've seen here in Washington is a huge demographic shift where we're becoming more diverse over time. Would you say that's been true, what you're seeing here in Tacoma-Pierce County?
Yeah, I think things are shifting, right? They're always shifting. And, the U.S. is a country of immigrants, right? I mean, we have American Indians, the original native indigenous people here, but then everyone else is really an immigrant, right? And so there have been various trends over time. So, for example, when I was working in Seattle, at one time I was working with International Community Health Services, which actually started taking care of the Filipino population, right? There was a large Filipino population, and that was related to the fact that the Philippines was considered a U.S. territorial colony, and so Filipinos could come work here despite there being like the Chinese Exclusion Act, right? There are certain countries and ethnicities were intentionally excluded, but the Filipinos were allowed to come here. So there was a large Filipino community here, and also worked in the canneries in Alaska. But over time, right, in the 70s, I think there was this huge shift. And before the Filipinos, of course, there were a lot of Cantonese Chinese who had come for various reasons, including building the railroad. And here in Tacoma, this was the terminus of the Northern Pacific Railroad. So there were, and I say were, many Chinese who were here. But then in 1885, they were expelled, right? So, and so coming back again to the 70s, there was a large influx of immigrants and refugees from Vietnam, Laos, Cambodia, and then subsequently things have continued to shift, right? So I understand your parents are also from Taiwan. My parents are from Taiwan. My parents, my father as a physician and public health professional came as kind of educated professional person, whereas, I mentioned like early on, a lot of the, the Cantonese people who came were laborers or worked in a restaurant or other businesses. But then there are different generations, right? So there were those generations of, say, for example, the Cantonese, and now we see the Cantonese people from Guangzhou and southern China, they speak Mandarin. I mean, they may also speak Cantonese, but they also speak Mandarin, right? Because of the educational system in China now being based around Mandarin. So, and then it was interesting because, we saw, in the 70s from the Vietnam War and the Southeast Asia, different groups, right? So not just the Vietnamese, also the Cambodians and Laotians, but even within those groups, different ethnic groups, right? So they're the Cham who live in Vietnam and Laos, right? I mean, they look perfectly Asian, but they have Muslim names, and they're Muslim, right? And they're ethnic minority, and I think everyone's familiar with the Hmong, but when I was at International Community Health Services, we actually took care of a lot of the Mien, who are another ethnic group from Laos, and kind of overlap into southern China, right? And then even among the Pacific Islanders, like in Seattle, I think we had more Samoans. Here in Tacoma, we have a lot of other Pacific Islanders like Marshallese, Chamorro. So just a little different dynamic. And then as subsequent generations come in, they bring different, it's different, a little bit differences in culture. And so it's just dynamic. And of course, over time, sometimes if the younger generation comes and they bring their parents, and then those who came as young people like me, we have our kids who are now, Asian Americans. So just kind of shifting demographics. But regarding your audience with AARP, I mean, in general, right, the population is aging.
Yeah, I really appreciate you pointing out the diversity. It is, in fact, May, and it's Asian American Pacific Islander Heritage Month, so it's a chance for us to recognize that. I think that there are so many strengths or assets or beautiful aspects about the diversity, but I also think that when we begin thinking about caring for our elders, it presents some challenges as well. And I know that both you and I have aging parents and are beginning, or I think you are a little further into the caregiving journey. But as we think about the diversity of all of these groups, can you talk a little bit about what, either from your own experience or from your role as a health director, what do you see as some of both the strengths and the challenges as we want to care for our elders?
I think, one of the significant challenges for the elders, the challenges depend on when they came, right? So, if the elders came when they were, say, professional age, right, and they were working, that's a little different than if they came when they were closer to retirement, for example, right? So I think people who worked here, they often have some degree of acculturation, right? So, and certainly those who are in more professional professions, they have to be acculturated, right? They have to speak good English. They have to, when there's social events, they need to eat American food and so on, right? And be able to talk about American culture. So there's a lot of variation, and not so much, I think, here compared to, say, the Bay Area in California. But in Bay Area, you can be in communities and never speak English, right? And you can be in communities and never have to eat American food. Whereas here, I mentioned briefly the history of the expulsion of the Chinese in Tacoma. I remember when my parents moved here in 1990 and they lived in Federal Way, my mom bemoaned the fact that she couldn't buy Chinese vegetables, right? I mean, there really wasn't any Asian grocery stores. And over time, right, I think the Vietnamese and the ethnic Chinese from Vietnam have come in and set up grocery stores. The Koreans now have their Korean grocery stores, and they've all become kind of pan-cultural or pan-Asian. And actually you see a lot of Latinos shopping in those stores because they also like their fresh fruits and vegetables. They also like their fresh fish, right? So, obviously food is so important in Asian cultures. Just as, well, the joke is, right, like with pasta, like the Italians stole that all from China, right? But just as Americans are very familiar with all the different names for pasta, well, in Chinese, right, there's so many different kinds of noodles, and there are wheat noodles, there are bean noodles, there are rice noodles, and I'll tell you a funny story. I was at a meeting and they ordered from a Thai restaurant, and first when I looked at the name, I said, that sounds Vietnamese, right? But when the pad thai came and it was the wide rice noodles, it's like definitely not real Thai, right? I mean, it's like pad thai is with the narrow rice noodles, not with these wide rice noodles. So food is obviously a very important thing, right? Language is another very important thing. And, again, depending on the generation that someone came, they might be comfortable moving around speaking English, or they might not. And then you run into issues about can they get the services they want? Do people make fun of them? And during COVID, you also have to really worry about that. If you didn't speak English, people may target you because there was all this rise in anti-Asian hate, right? And any excuse, we already look different, but if we also spoke different or had an accent, right? That was a challenge. Getting around is another issue. So, my parents lived in the very southwest corner of King County and practically, like literally a mile or two from the Tacoma border, right? And when my mom was ill, trying to get a caregiver to get there was really difficult, right? So caregivers are not well paid. And when they had to drive, right, there was no bus service to where they lived. It was the furthest southwest corner. And you can imagine if they're spending 45 minutes or so driving to my parents' house, and then they get paid whatever, relatively low wage they're getting paid, and then they have to drive another half hour, 45 minutes to their next job. It just doesn't make sense, right? So it's just very difficult. And then there's another quirk, which is, for Asian people, they're very clear about their culture. They're very proud about their culture, right? So, for an American agency, they might say, oh, don't worry, we'll send you an Asian person. Well, right. I mean, if you're Chinese and they send a Korean person, it's like, that person's from Korea. They're not, right. Chinese, right? That everyone does that. All cultures differentiate themselves from other cultures because they're very proud of their culture. And I think especially in Asian cultures, there's so much pride in the language, the culture, respect for elders, the foods they eat, so on and so forth, right? So trying to make sure that's available for the seniors in our community is a challenge. And fortunately, I think there's greater awareness of it now. You just look at the restaurants, we actually now have lots of Thai restaurants now, right? And there are lots of Vietnamese restaurants, and they don't have chop suey restaurants anymore because the Americans finally figured out it's not Chinese, right? So there is greater awareness of it. But there, when you talk in that umbrella term of Asian and Pacific Islanders, it's huge. Right. I mean, when I was up in Seattle, when you talk Pacific Islander, most of the time it was Samoan, right? And I mean, King County also has a pretty big Hawaiian population, but down here we also see, more Tongan, and Marshallese, right? Other groups like that. So even within those groups, while they share a lot of similarities, there are differences. And especially for the elderly who come later, it's so difficult for them to shift, right?
Yeah. And I really appreciate you raising the issues. I think what we've learned is transportation is one of the biggest issues. I think the issues around food and around community that you're speaking about, I mean, part of that is really around comfort and well-being. And I know that as I get older, I like being comfortable, for good or for bad. That is something that I really enjoy. And so making sure that we have those community connections. And that's something that we saw during the pandemic as well, right? Was that issue of social isolation. Is that something you think that we are beginning to come out of? And are there more things that we need to be? What are some of those lessons that we learned during the pandemic as it comes to making sure that our older populations are doing okay? Are there some things that come to your mind that stick out in particular?
Yeah, so I'm going to address a different question first and come back to this, right? Which is, in the beginning of the pandemic, it was very striking to us very early on when we looked at the demographics of who got sick. And so Pacific Islanders got COVID at 4 times the rate the white population did, right? And then for Blacks and Latinos, about 2 times. Asians were similar, right? People identified as Asians. So, and American Indians, Alaska Natives were about twice the rate. And, we were worried about this, and we were thinking, like, is this racism? Is it what exactly is mediating it? And one day I was riding my bike. Well, actually, that's a very Asian thing, right? So there's a produce store about 7 miles from where I live. It's really cheap produce, and like all Asians like a bargain, right? So it's not worth driving your car for, but I will bike 7 miles to go to this produce store. And it goes by the east side Tacoma. And those of you who aren't familiar with Tacoma, there's Portland Avenue where there are a lot of the Pacific Islanders, like Cambodians and Pacific Islanders live on that, and McKinley is much more the Latino population, right? And I was riding down McKinley, and when you cross 72nd, which is city limits, all of a sudden it struck me. The homes I was seeing there were kind of like rural North Carolina when I used to work there. And it's just poor housing stock. And what did I just say? Who lives on the east side of Tacoma, right? So a lot of the Southeast Asians, the Pacific Islanders, and of course the Latinos. And what else? Culturally, they live in large families, right? I mean, the U.S. is like your dream is, as soon as you can, you move out of home, and then when you get married or get established, you buy your own house, you move far away from your parents, right? But for many of our Asian and Pacific Islander communities, we still live in large multi-generational families. Well, also, these families or these people work in certain industries. So if you go to the airport, for example, a lot of Samoan baggage handlers, right? And of course, there are many of the Asians are working in restaurants or in grocery stores, right? And remember, during the pandemic, those were essential services, so they had to work through it. And guess what? You work in an essential service, you don't have actually, some of them do have sick leave, but many of them didn't. And then you come home to a house where you've got multiple generations and it's poor housing stock, right? Because you're not earning a lot of money. That was just perfect breeding ground for COVID. And fortunately, what we saw with those communities recognized that, and because of the value of the elderly, they started to get vaccinated at very high rates. So that was the good news. The bad news was we could see how the social, economic, and environmental conditions and the cultural, preferences of these people really came to play in, increasing their risk, and we had to address some of that.
I really appreciate the picture that you have just shared with us, because I think it dispels sort of the model minority myth, right?
Mm-hmm.
That all Asians are doctors and engineers and have no issues with wealth. And so, in fact, we do see, in fact, that some of the highest poverty rates are, in fact, in some of our Asian ethnic subgroups and amongst Pacific Islanders. I think we talked a lot about this, and at that time, obviously, I was at Seattle King County Public Health, where as we were working to try to reach our different groups, and the issue with the housing and quarantining at that time was a big challenge, especially for some of our Pacific Islander families who live in exactly like you've talked about, the multi-generational households, and sort of, how were we going to take an elder in their family or the person who's the adult, the parent and caregiver, both in that sandwich generation away because of COVID. Very, very difficult.
Yeah, yeah. And, my dad and mom, even though they were economically well off, but they didn't need to, but they would go to like the community center, eat lunch, and then, do line dance or whatever. Then they'll go to the senior center, and then they were members of the Tacoma Chinese Association, the South Puget Sound Chinese Association. Then, there's a Taiwanese association. My father's a graduate of National Taiwan University, so there's a National Taiwan University Alumni Association. There are all these different groups that they participated in. And I came to realize why. It's because there are different demographics, right? So the South Puget Sound Chinese Association, for example, has more like Cantonese and, some, people who were born in the U.S. And then the senior community centers, these were different socioeconomic classes. There were also more white people, right? So they kind of had it built in that there are many different groups that they socialized with. Unfortunately, when my mom got cancer, I think they pulled back a bit from it. But then when COVID hit, if you remember, all of that shut down, right? And on top of that, my father being a physician and a former public health practitioner was just petrified about risk of infection. So he, for 2 years, basically did not go out of the house except every afternoon would go to the nearby park and go for a walk with my mom, right? And so it really set people back. And, the same way that we talk about how, in the early part of COVID, we had to shut things down. We had to take kids out of school, and then we tried to get them back because we knew that when they were socially isolated, the kids were not doing well. They weren't learning as well. They were getting more stressed out. And of course, their parents were stressed out too. But I think we forgot the same applied for the seniors, right? And I remember having a conversation, and actually a constituent reached out and complained that his mother was in a senior community out in Gig Harbor, and was upset that they were not serving congregate meals, that they were just keeping people in their rooms, bring meals to them, even when there wasn't an outbreak, right? So what I said to my staff is, this is exactly like the kids. We have to protect their health. Remember, we had no vaccine, we had no medicines, but now that we have other measures, there's only so long you can hold your breath. That the seniors, they start regressing. Emotionally, they get depressed, right? And if they're having any cognitive decline, their cognitive function gets worse even faster because they're not practicing the language, they're not interacting with people, they're not playing games, they're not dancing, whatever, right? So it's this same challenge, really, with the seniors during COVID.
That social connectedness is so important. I really appreciate you highlighting some of these things, particularly as the public health director. I want to make sure that folks know that Dr. Chen has been here as the public health director for 14 years. Is that correct? 14 years? Yeah. And you're soon to retire and step down or transition into your next journey. But for folks who don't know, Dr. Chen has actually been one of the few Asian American Pacific Islander local public health leaders, and I should just say public health leaders across the nation, because it's been relatively few. While people often think about physicians and that there are many Asian American physicians, it's not true in terms of public health leadership. And so I remember meeting you, I think at the first time at a a NACHO meeting, which is, I don't know what NACHO, National Association of City and County Health Officials meeting. And part of what made me so thrilled about meeting you was meeting another Asian American who was in the field of public health, but also then had a lens of looking at other communities beyond the mainstream, and recognizing that there are unique needs within our Asian American and Pacific Islander communities. And so I know you've been a huge champion as well in our communities here locally and in Washington State, and I just can't tell you how much I appreciate all of what you've done. You've been a model for so many of us.
Well, thank you. You're very kind. I was joking with our Secretary of Health, Umair Shah, right? I said, Umair, I was the highest ranking API public health official till you came along. Now I got bumped.
That's true. In Washington State, we're actually doing pretty well now, aren't we?
That's right. That's right.
We are. So another thing that folks may not know about you, but because we're Facebook buddies, is that you do these amazing posts of your meals and of your shopping. I think people know you for your healthy habits. Can you tell people a little bit about how you take care of yourself?
Well, I've always, believed in eating healthily. And I mean, when you grow up overseas, right? I mean, that's what you do. We didn't used to eat a lot of processed foods, lots, in Chinese cuisine, lots of vegetables, right? And, my parents both grew up during the wars, so they would always tell us about how little meat they had during the war, right? So, we did not eat large quantities of meat. And however, coming from a more traditional Chinese family, my mom did not teach us how to cook. But when I went to boarding school, she made sure we knew how to scramble an egg or, make instant noodles or something. But one of the things we did when I was at prep school is we had an International Student Association, an Asian Student Association. We would make money by making dinners and selling it to the other kids who were tired of school food, right? And so then what I would do every summer, I'll go home and tell my mom, teach me how to cook. And then when I was in medical school, you're so busy. Usually I would have loved to be biking, doing artwork, photography, the other things I enjoy. But in medical school, you're so busy. But I figured you always have to eat. So that's when, I spent a lot of time learning about, vegetarian cooking, healthy eating, things like that. So now I mostly cook vegetarian. And part of that is I just find it so much easier. I do eat meat, and every so often I will cook with meat. It's just so much easier to cook vegetarian. Your cleanup is so much easier. You don't have to worry about dealing with the meat and the vegetables. And having grown up in so many places and interacted with so many different cultures, I eat all kinds of food. So,
let me just say, we are so lucky that you have been at the helm here it's not only Tacoma-Pierce County that has been benefiting from your leadership, but also Washington State. And I will say that we try really hard in Washington and local public health to be leaders, not here locally, just locally, but also as part of the nation. And so just, again, so appreciative of everything that you've done. So folks,
I hope you've enjoyed this conversation, and I want to encourage you to learn more about our caregiving journey and resources that we have. So please go to www.aarp.org/caregiversWA, so Caregivers WA, for more information, as well as please take a look at our blog posts that we'll be writing that accompanies this video. And until next time, take care, everybody, and we will talk to you again soon.